Amiodarone is classified as a Class 3 antiarrhythmic drug, primarily acting as a potassium channel blocker. It works by blocking potassium channels within heart muscle cells. Amiodarone is indicated to treat various arrhythmias, especially when other antiarrhythmic drugs are ineffective or contraindicated for the patient. Amiodarone initiation must always be done in a hospital setting and under specialist supervision due to its potent nature and potential side effects. Amiodarone comes in various medicinal forms. For intravenous administration, we have ampules, typically 150 milligrams in 3 milliliters, and also pre-filled syringes of strength 300 milligrams in 10 milliliters. For oral use, it's available as tablets in both 100 milligrams and 200 milligrams strength. Moving on to mechanism of action. As mentioned before, amiodarone inhibits potassium channels. This delays the repolarization phase, meaning the heart muscle takes longer to reset, reducing their excitability to stabilize erratic heart rhythms and effectively treating arrhythmias. But amiodarone is unique because it's a multi-channel blocker. It also inhibits sodium channels, slowing down conduction within the heart. It also blocks calcium channels, which helps to slow down the heart rate and conduction. It even acts on beta receptors, reducing the effect of adrenaline on the heart, thus reduce heart rate. This overall action contributes to its effectiveness, but also explains some of its potential side effects, like bradycardia, hypotension, and QT prolongation. These effects are crucial to monitor when prescribing amiodarone. Let's move on to indication and dosing. For the general treatment of arrhythmias, we treat with oral tablet administration. A typical loading dose is 200 milligrams 3 times daily for 1 week, followed by 200 milligrams twice daily for another week, and then 200 milligrams once daily for maintenance. For intravenous administration, the initial dose is typically 5 milligrams per kilogram, given over 20 to 120 minutes, with continuous ECG monitoring. Subsequent infusions are adjusted according to the patient's response, with a maximum of 1.2 grams per day. For the critical treatment of ventricular fibrillation and pulseless ventricular tachycardia, during resuscitation, the recommended dose is a 300 milligram bolus with an additional 150 milligrams if required. When we talk about side effects, amiodarone is quite a nasty drug. It can affect many organs in the body. To start with the eyes, patients can develop corneal microdeposits, sometimes described as cat whiskers, which can lead to visual disturbances like night glare when driving. It's important to counsel patients about this. In serious case, it can cause optic neuropathy, potentially lead to blindness. Patients must be advised to stop the medication and report immediately if they experience any impaired vision. Next, the liver. Amiodarone can cause hepatotoxicity. Patients should be counseled to report any signs or symptoms. A little lighter, a helpful mnemonic for these symptoms is never vacuum jelly beans, mum is baking again, which stands for nausea, vomiting, jaundice, malaise, itching, bruising, and abdominal pain. The thyroid gland is also commonly affected, leading to thyroid dysfunction. This can manifest as either hyperthyroidism, where we might give carbimazole and withdraw amiodarone, or hypothyroidism, which is typically managed by starting levothyroxine, often without needing to withdraw amiodarone. On the skin, photosensitivity is common. Patients should be advised to use high SPF sunscreen to protect themselves from light. A peculiar side effect is the development of a bluish discoloration of the skin, known as blue skin syndrome. Patients should be advised to report if develop blue skin syndrome. Amiodarone can also affect the lungs, causing pulmonary fibrosis. This is a serious side effect as it is potentially fatal. Patients must be counseled to report any shortness of breath or dry cough immediately, as early detection is key. Finally, peripheral neuropathy can occur, manifesting as numbness, tingling in the hands and feet, and tremors. Patients should be advised to report these sensations. Given amiodarone's extensive side effect profile, careful monitoring is essential. Before starting treatment, a chest X-ray is needed to assess lung function. Blood tests should be done before treatment and every 6 months thereafter, testing for potassium concentration, thyroid function via TSH, T3, T4 levels, and liver function. An annual eye test is also crucial. Additionally, blood pressure and ECG must be regularly monitored, as amiodarone can cause hypotension and bradycardia. Now, for drug interactions. Amiodarone has an incredibly long half-life, around 50 days. This means there's a danger of interactions persisting for several months even after the drug has been stopped. One critical interaction is QT prolongation, which can lead to a life-threatening arrhythmia called torsade de pointe. We want to avoid co-administration of amiodarone with other QT prolonging drugs. This includes other antiarrhythmics like sotalol, certain antibiotics such as macrolides and quinolones, antipsychotics like haloperidol and lithium, antidepressants like SSRIs and TCAs, antiemetics such as ondansetron, and some antifungal medications like fluconazole. Next, certain drugs and even foods can increase amiodarone concentrations. For example, grapefruit juice is a significant enzyme inhibitor and can lead to higher amiodarone levels, increasing the risk of toxicity. Conversely, amiodarone itself is an enzyme inhibitor, meaning it can increase the concentration of other drugs. Key examples include warfarin, digoxin, theophylline, phenytoin, and statins, which can lead to a risk of myopathy when combined. There's also an increased risk of bradycardia and heart block when amiodarone is combined with other drugs that slow heart rate, such as beta blockers and rate-limiting calcium channel blockers like verapamil and diltiazem. Certain antivirals like sofosbuvir and ledipasvir can also interact with amiodarone. Patients should be advised to recognize signs and symptoms of bradycardia and heart block, such as shortness of breath, lightheadedness, palpitations, fainting, unusual tiredness, or chest pain. This is Pharmacademy by Luna. Thanks everyone for watching.